Jim Joyce with
Here we are, man.
another Wednesday, another shot.
Absolutely. And
Wait, I
you're
am
calling from Italy?
I am calling in from Florence. I was gonna do my more formal, quick. I'm your
Okay,
host,
go.
I'm the co-host of the Shot of Digital Health Therapy with Jim Joyce. Welcome to the show, to our show. We have an exciting guest coming up.
Welcome, everyone. So, Eugene, tell me where, I know you're going to do the formal introduction, but you find yourself in Florence, Italy?
Yes, so my older one is graduating, so this Friday. So we're just running around last things. Actually, on Tuesday, which was yesterday only, she presented
Okay.
her a thesis project, which actually is culminating into a fashion startup that she got to pitch in front
Ooh,
of an Italian accelerator. So let's see what happens. Maybe she's following her parents' footsteps. But yeah, and then
absolutely.
we're excited. It's 4 years have flew by, as you know as well, right? But
So quick, man. So quick. And she started with all the weirdness of the pandemic and coming through. And
well,
congrats to her. That's amazing.
both of our older kids didn't really have
Yep.
a high school graduation, right? So,
Yep.
hopefully, you know, anyway. But good. I know there's lots of stuff happening. I know we skipped, but I say we dive right in. We have
Let's dive in.
Stephen. Yeah, Stephen is waiting.
Great.
So
I think as he's coming in, everyone's going to be in the health next week, right? So
that's right.
is that next
Looking
week?
forward to Health Amsterdam. Yeah, quite a lot of stuff going on there, and excited for it. And let's see if we can convince Steven to book a ticket to Amsterdam last minute. No?
Not this
Welcome.
time around.
No, I know. Welcome, welcome.
Hey,
It's been
Stephen.
ages
How you
since.
guys doing?
Good, good. Welcome to the Shot of Digital Health Therapy. We've been wanting to get you on for a while. We finally booked you way ahead, even though we're meticulously unproduced. And I don't know if you've ever met Jim, but if not,
I don't think
Jim.
we've met in person, have we, Jim? I can't recall.
Everything about you is very familiar to me.
Yeah, I feel like we've probably been in the same room across paths, but I can't recall
Exactly.
if we've actually had a conversation and shook hands. So
And I was looking through your background. It's so phenomenal. I'm really excited to hear about it. But it's a pleasure to meet you. If my aged brain is as picking that up, but it's great to meet you.
yeah, great to meet you as well.
But
And
for
apologies
the
for lighting. I had to switch rooms. I was supposed to be in the city today, but I was like, you know what? I might have more reliable internet at home. I can control the environment, and I'm just gonna do this, and then I'll run to the city immediately after this for this meeting I have to do.
So for our millions of listeners and viewers, let's do the usual. Take us through your life journey, and then Jim and I, as always, will interrupt accordingly. So
My life's journey. That's an interesting question. So, yeah, I started out in government service as a way of paying for college, and so my first foray into government service was being in the United States Marine Corps. And so, I did that right around the same time that September 11th happened, and actually just before that. So I was in between the two Gulf Wars, and never saw combat. I was pretty fortunate in that sense, and then got out shortly after September 11th. So really was fortunate in that sense. But I do think like a lot of the training I had in the Marine Corps really shaped kind of how I approach situations in life and some of my OCD that I have to this date on, attention to detail on things. And absolutely would do it again. But that's where I first got kind of introduced, the 6 to 8 years I spent in the United States military. Um, Fast forward from there, I went to college and got my background in finance and international business, but ended up in state government as like my first real job, so to speak. And the first agency I worked for was the Human Rights Commission for the state of Illinois, and got to be at an agency that was adjudicated human rights violation claims underneath the Human Rights Act, in both at the federal and state level. But I was not a lawyer or a human rights background person. I was there to be their CFO and run like the whole operations side of it. So it was a very small agency, a lot of judges and attorneys that worked in it. And I was the one with the business background and had to wear a lot of hats. So even though I was the CFO, I had to do HR, I had to do all these other things for them, handle all procurements and you name it. and make sure that they had.
You were the bean counter, as they say.
I was the bean counter. I was the one. The way that I looked at it was I needed to make sure that all those legal brilliant minds had the tools necessary to be the most efficient and successful in the work that they had to do. We had a huge backlog in cases, and if you think about it in the sense of somebody who is reporting a human rights violation, they're denied a loan based on their sex or their race or some kind of other act. They may not see, a justice or have a determination made on it for, 3+ years because of this backlog in cases. And think of what that means if you can't get a job or if you got kicked out of your apartment because of some kind of discriminatory act. It's sometimes late justice is not, sufficient enough, and certainly, it doesn't really address the systemic problems that are going on. So
isn't
very serious trying to figure out what I can do to reduce that backlog, modernize the systems, and try to help in any way that I could, both through my role as managing the budget and getting more funding to do more things like that, but also in being able to get like the right technical tools, and to like modernize the agency. And then after that, I got transferred over to recruited to go over to the Department of Commerce and Economic Opportunity. And that's really, I think, where a lot of the work that I do today really started to kind of explode. So I focused a lot on, I was the chief of staff for the Department of Commerce for about 4 years in Illinois, and did a lot of innovation ecosystem building as a means of economic development. How do we get more entrepreneurs to be successful in the marketplace? How do we attract more capital to the region to support their growth? How do we create the right conditions through incubators and accelerators and boot camps and all of that? Angel tax credit investments, you name it, to provide that kind of environment for success.
Are you from Chicago, Stephen?
Yeah, so I had lived in Chicago at the time. I was born in New Jersey, moved to Florida when I was 10.
New Jersey. We got Eugene here. Yeah,
there you go. Right.
Where in New Jersey?
So if you look at New Jersey as an hourglass, I was in the center of the top part, up in Lake Hopatcong, which is near like Wayne, Patterson, Parsippany, that whole area.
Of course.
But yeah, when I was around 10, though, we moved to Florida and went through middle school and high school there, joined the military. And then after that, I ended up in Chicago.
At university, or that just?
Yes. Yeah. Okay. Well, so after I got out of the military, then I went to college at that point, and I went to Loyola University in Chicago, and started working up there, and met my wife, started having kids, moved out to the suburbs. The whole typical.
Yep.
Yeah.
The perfect ideal.
George Clooney? Because Eugene, I think you're probably with the Clooneys in Italy right now. You're in Florence somewhere, right? Isn't George Clooney's wife a human rights activist lawyer?
Oh yeah. Yeah. In fact, there was he got some kind of a lifetime achievement award, and the person who was like introducing him, or maybe it was at his roast or something like that, was talking about like he's married to Amal, and they do over like her whole resume of like all that she's done in the human rights space, this brilliant attorney, and all the impact that she's had. And then they're like, but hey, George is the one who gets the life achievement award, which is pretty hilarious.
But wait, what am I doing on this if George Clooney is in town?
Yeah, you guys are gonna go have a nest afterwards.
Exactly. No, I was just thinking he's always in Italy. He's married to an Italian, and he's in Italy. You're probably hanging out with the rich and famous there, Eugene.
Typical Eugene.
It is Fashion Week here in Florence. As my older one is graduating fashion school, so it's a bit crazy around town. But anyway.
Did she do your hair and makeup?
Of course.
For the guy. Okay. So sorry. So we're now at
let's continue. This is what we do, Stephen. This is what we do.
No worries. You know me. I can roll with it. So yeah. No, I went to commerce and really obviously got to see like all intricacies of how you do economic development, and really kind of as chief of staff got to pick kind of like areas that I wanted to spend more time in and double down in. And the innovation ecosystem building part of it, right? How do you build communities as an ecosystem to produce more innovation and more innovative solutions and companies and so on, attract more capital? All of that was something that I, really kind of, got excited about and started to research. I was kind of tasked with helping to research that across the country and how, this is in the mid 2000s to late 2000s. And so kind of looking at how were they building an innovation ecosystem? How did they build it in the Silicon Valley area, but also in Denver or San Diego and Boston and these other markets? Looked at a lot of the work that EDA was doing, Economic Development Administration, to build fostering ecosystems, and looked at a lot of work that NSF was doing, National Science Foundation, on the topic. It got to a point where we were building some of those same types of things and adapting it to fit Illinois' need, but really as being an anchoring hub for the Midwest overall, based in Chicago.
And what works?
What's
what
that?
works? What works?
Yeah, well, there's a science to it. There's definitely some models out there that you can get into where part of it is just mapping your local regional strengths, the assets and actors that you have, and then figuring out how can you leverage all of that to your best ability. Kind of the 3 C's were something that I learned over the years, or helped come up with, which is how do you both convene all those different stakeholders who have a role to play in fostering that innovation.
Okay.
Making the most efficient use of what assets are available in that ecosystem. And then, after you've convened them, the next C being, how do you now get them to collaborate in some way, get them to kind of like look for shared common ground and interests. And that's sometimes through events or activities, partnerships, whatever it may be, that get them together. And then how do you, now you've got them familiar with working together and seeing the value in working together, then how do you, the third C, catalyze them to, actually go out and do something about that and actually partner in doing that work and producing all that innovation. There's a kind of a life cycle for it, right? All the money that goes into the early research and development, if you make the most efficient use of it, it can kind of follow a life cycle around to where it gets commercialized. And then that produces more profits back into the system that you can reinvest in more R&D and so on. And that's where you're trying to figure out is how can we cut out any waste or inefficiencies in the entire life cycle that makes it easier for people to, for investors to find the right startups to invest in, right? For in this case, healthcare systems. At the time, I was working in kind of not in one specific industry until actually we started building a clean tech innovation ecosystem, kind of the whole green jobs movement era, But we're trying to figure out like how can you bring all those parties together: academia, local government, federal government, entrepreneurs, large private partners, other key stakeholders. Get them to all think about like how can they be more efficient and identifying where the demand is and being that as a driver for creating the supply to meet that demand. So we did a lot of things. We launched an innovation accelerator and an incubator for the state in Chicago. 1871 was the first big incubator we launched. That's now expanded 3 times. It's still rated as, depending who you talk to and what metrics you use, it's still rated as one of the most successful or best incubators in the world. Hundreds of startups go through there annually and are part of the community. And a lot of the science of that incubator was stolen from other models where we, figured out how do you get more companies, not only startups, but also large big tech companies, professional service firms on the lawyers, on the legal side, on the banking side, on the PR side, whatever it may be, to actually spend time in that incubator space and do office hours, mentorship, and so on. For them, it's a feeding ground. The next big startup who explodes might be their next big customer who uses their services. But also for the startups, they're getting, free or low cost exposure to all those types of things that they need to build a company and grow it. Makes it easier for investors to find them and to hear from all the other stakeholders about, how valid is their approach, the co-design opportunities. So it creates all those opportunities. It's part of that big convene and collaborate, piece where you're bringing them all together in the same space. And as a colleague of mine, Steve Collins, who later launched Matter as a spin out of the 1871 accelerator. He used to talk about serendipitous collisions, right? Like how do you create those opportunities where things you don't know could lead to the next big innovation? How can you create those opportunities to bring people together and have those collisions happen?
So, I use Matter on my last company, Health Beacon. We used Matter. We found them unbelievable. We were actually based in Dublin, Ireland, Boston offices, but then we joined the Matter, and that was like one of the best networks. Just super supportive.
And one of the secrets to their science is followed on the 1871 model was, look at who are all those organizations who have a role to play in supporting that ecosystem, specifically for healthcare, because 1871 was industry agnostic. And there's about, if you know the story, there's about 30 startups in the 1871 space a couple of years in that were all healthcare related and said, with the Affordable Care Act being put into place and the future of healthcare completely changing, like there's too much of an opportunity for us to not have our own space And
Right.
also locally in Chicago and in the Midwest, there were some amazing assets to lean on. So
Yeah.
you had the American Medical Association headquartered right in Chicago, American Hospital Association headquartered right in Chicago. You've got
Right.
some of the largest biopharma life science companies with either their North American headquarters or their global headquarters based in Chicago, right? So
Yep.
that's Baxter, Astellas, Takeda, Horizon,
AbbVie.
AbbVie, Abbott,
Yeah.
like the list goes on and on. And so, the idea was how can they create a space that all of them can participate and be a champion of that ecosystem and come participate in it. And, there's many other examples of key stakeholders they leaned on. And government provided some initial startup cash, both the state and the city, both in the case of 1871 and Matter. But it was basically, giving them a 3-year horizon with some operational and some, capacity building funding. I think it was right around 10 million or so. And they actually used that to get some funding from other key stakeholders like venture firms and others. And then basically that gave them the runway to build it out, get their programs to become self-sustaining, get their own funding model put in place with, membership models or sponsorships and, championship agreement, that kind of thing.
Awesome.
But it helped really create this whole massive ecosystem in Chicago that wasn't there before. And now, Matter has over 200 startups that are part of its network and spend time in there. Obviously, the pandemic impacted every incubator space and, the ability
Sure.
for people to convene in general, but a lot of that has come back since then. And the successful incubators out there have pivoted to models where they can do more virtual programming, more virtual accelerator programming, just, to self-sustain it, virtual meet and greets and opportunities. But it helps educate the whole ecosystem, right? And after I left Commerce, I went to the Illinois Department of Public Health. And at that agency is really where I started to hone in on like the healthcare side of things. Right? Before it was more industry agnostic. I worked a little bit on the clean tech side and biolife sciences because it was such a big economic engine for the state. But we were at that pivotal moment right when I went to public health. And I was, to be honest, I was a fish out of water. Like when they recruited me in the governor's office, asked me to go to public health and be the chief of staff and COO for
And who was governor? Who was governor at the time?
so it was Governor oh God, my brain is
Amen. What?
So this is after Blagojevich, Governor Quinn. Sorry. And this is
Quinn.
right before Governor Rauner, right
Right.
now
Okay.
Governor J.B. Pritzker.
Okay.
And it's ironic, J.B. Pritzker, the current governor for Illinois, when I was at the Human Rights Commission, was technically my first boss in state government because he was chairman of the board for the commission, and I had to
Right.
give my reports to him, my financials, and so on every month. And then fast forward a couple years later, when we launched 1871, his venture firm, Pritzker Ventures, was one of the ones who came in and helped fund the getting 1871 launched, in addition to Matter as well. So he's been a great partner for years. But this was underneath the Quinn administration back in that era. And they're very supportive of building an ecosystem and being kind of an example for the Midwest as a whole, not, allowing the Midwest to continue being a flyover state where all the investment is on the coasts. And rather that we had a lot of entrepreneurial talent and an ecosystem that can't be ignored in the Midwest. And the funny thing is we did some studies with the Brookings Institute and some through the Midwest Governors Association looking at the region. And actually, we found out some very interesting things. At the time, this was probably around 2010, 2012, somewhere in there. Through the study, we actually found that most investors didn't see us as a flyover region. That actually they did look to invest. And actually, a lot of the investment that was being made in Midwestern startups and Midwestern companies was coming from outside of the region. So it was actually a problem of retaining our own local capital. So we had like Midwest investors that were making investments outside of the region. And so we had this whole myth about oh, we can't attract all this big capital from the coasts. When in reality it was we can't even keep our own capital, but we're getting a lot of investment from outside of the region.
You find that I bet it happens in Spain, Eugene, or like it happens in Ireland where they set up these Irish investment funds and then they're just dying to make they have rules about making a certain percentage of investments in Ireland, and they're just dressing up American companies as Irish companies, and then the Irish companies are being dressed up as American companies.
Yeah.
So they're all
I think that's part of the challenge of a bit of the private-public partnerships regionally, right? Because there are some restrictions placed, and I completely understand why, right? I mean, you're trying to inspire the local ecosystem, but that has certain limitations. It's, I think there's duplication of efforts in regions. I mean, I remember when I lived in Netherlands, right? Like North and South Holland, like you can count the startups on like two hands, right? But
Right.
duplication of efforts because of regional funding. And I'm sure the same thing happens kind of state by state and nation by
Right.
nation.
Yeah, I think there was definitely this old way of thinking back in those days, and I was part of the next class that was trying to challenge that way of thinking, and so there was this big kind of competitive nature. We want to attract all the companies and investment to our region,
Right.
right? And looking at it as the viewpoint of a successful ecosystem being one that has and maintains and keeps and attracts startups and investors, right? And looking
Right.
at it just through the lens of that. The more startups you have, the more investors you have, the more capital it's deployed, the more growth of those companies, those new entrepreneurs. That is your metric for success on your economic development, approach and building that ecosystem. But now I think most ecosystems have, in most regions and states, have started to take a broader view and this bigger picture, this new way of thinking of it's not just about the startups and the investors, but it's all the customers of those solutions as well, right?
Right.
And so, you can look at it in the case of an entrepreneur and going from 2 employees to 20 to 500, high growth company, the next billion-dollar company, and being like, wow, what a great success story that's going to create a lot of economic output and employment in our state, right? Or in our city. And there's some truth to that. But what about the other side of the coin, right? Which is, who are they selling to?
Yeah.
Is it a healthcare system, a large, healthcare system, or multiple healthcare systems? And is it creating more jobs? Is it helping that system be more effective, right? Is it creating more opportunities for them to grow and be successful? And if you look at, them going from, 1,500 employees or 20,000 employees now to going to 30,000 employees because they've grown and they're more successful, you might have an even bigger impact if you're thinking about it in that context.
Or
So
better
ultimately,
outcomes
thought
for
is like,
the
you
patients,
can't,
right?
yeah, or the impact on patients and the healthcare outcomes, right? In
Oh,
this case,
Right.
again, we were thinking broader and not just in healthcare, but the idea is, it's not just the startups, it's the big tech companies, the other big private sector companies, it's government. They all benefit from that innovation as well.
100%.
And it's that's going to grow economic opportunity as well and help them compete on a national, international level and so on. And so, when you think of innovation ecosystems, it's good to take a local approach in building the connectivity and the environment for them to come together and be successful, but they have to be connected to a broader and more national and international ecosystem to be the most successful, right? And the way to put it in the context of healthcare is, for a healthcare startup to be the most successful, let's say in Chicago, Illinois, at Matter, right? They're going to need to find more customers than just the ones in Chicago and Illinois, right? They're going to need to be able to scale and sell to health systems in other states, or maybe even go global and export, right? And partner in other countries. And you need those connectivities and those networks to help them find those additional markets as they grow, right? Same thing on the other side of the coin, right? For the health system in Illinois to be successful, they need to have access to the latest novel technology and solutions and innovative startups,
Regardless.
just from Illinois, but from around the world, right?
Right.
And on the federal side now, there's something else we try to work at. We do have, when it's federal dollars, or in the case of the states, when they have state dollars, obviously, there's some strings that'll come attached to try to encourage more employment and more activity in that state. But most of them have been trying to think through how can we be a little bit more flexible, maybe through public-private partnerships, where some of that funding can go in that limited place, but then we can leverage some of it, or external funding to then come in and support attracting external solutions to come into that market, whether it's the US or in an individual state.
So Stephen, how is this? I mean, you've been at ONC or HHS, so I think I would also love for our listeners and viewers to demystify a little bit of, the responsibilities, ONC, HHS, how it's all connected, in a, maybe not a 10,000-foot view, but 40,000, because I'm sure it's complex.
40,000.
I work with a lot of startups, and so they speak in elevator pitch language, and so I have to
Exactly.
put my own elevator pitch. Otherwise, they
All
get
right.
too bloated and lost in the sauce, as they say. But yeah, so a good way to think about it, and I part of my job is getting out there and engaging with the innovation community, which I had to define like 10 years ago when I first started working at ONC. And part of that is like they're not as familiar with government. They're not as familiar with the different agencies, how we relate to each other, the organizational structure and where there's kind of ownership of different areas of healthcare innovation. They might be familiar with some of the big ones like FDA or CMS, right? The biggest payer, one of the biggest regulators, or maybe even NIH if you're lucky, one of the biggest funders of research and conductors of research in the world in healthcare. But there's over 20 agencies just under HHS, and then there's another 20 or so outside of HHS and the federal government that work on healthcare technology in some way. The obvious ones outside of HHS would be like VA or the Defense Health Administration, which actually deliver healthcare services. But there's a whole slew of other ones who also work in the space of health IT or have some intersection with it. And we get to collaborate them. That's the C in our name, the coordinator, to make sure that we're all kind of speaking with one voice or coordinating across federal government. We have our own domains, but we're also coordinating on all of it. So the best way to describe it is you've got the White House and the administration, the federal government level at a top end. And then underneath that, you have all the different sectoral, the Department of Energy, Department of Healthcare and Human Services, which is HHS, and VA and Department of Defense and all these other ones. Department of Transportation, you name it. But in the vertical of healthcare and human services, there's about, again, 20 something agencies that fall underneath it. You have operating divisions and you have the other divisions, which are more administrative in nature or programmatic in nature. So the idea is underneath that HHS umbrella of an agency, you've got, visualize an umbrella, right? And little lines going below it with CDC, Centers for Disease Control, right? Managing public health and prevention. You've got, NIH, you've got HRSA, AHRQ, you have all these acronym agencies, SAMHSA, which is Mental Health Services Administration. You've got all these agencies, FDA, NIH, it goes on and on. If you think about them all falling underneath this big, broad umbrella of health and human services, now look at the apparatus of the umbrella that they fall under. That's known as the Office of the Secretary. And that's where the Secretary of HHS sits, has purview across all those health and human service agencies. They all report up to the Secretary. ONC, the Office of the National Coordinator, is a very small agency, and we sit in that apparatus of the Office of the Secretary. And our job is to coordinate across all the federal agencies, and then also the national coordinator as a position, which is Dr. Mickey Tripathi currently. He's my boss. He reports not only to the Secretary of HHS, but he also reports to the White House as like the senior health IT coordinator for all of federal government. And so one thing that we do at ONC to help kind of do that coordination is we have an interagency body called the Federal Health IT Coordinating Council. And that agency has both all the HHS agencies underneath, or that coordinating body has all the HHS agencies underneath it, but it also has all these other 20 plus agencies outside of HHS that have some kind of health IT interaction. And through those, we meet regularly, we have work groups, and we all talk about all these issues as we're advancing health IT policy for adoption, utilization, responsible use, all that kind of stuff. I get to lead a digital health group underneath that, but it's basically this umbrella effort inside HHS. We sit in the Office of the Secretary, and we get to work across all those, and we have this role of coordinating with all these non-HHS agencies as well.
Is that easy?
Absolutely not. But
you haven't lost your hair yet.
That's well, part of it is you're dealing with different levels of technical knowledge. In some cases, the agencies outside of ONC are, in a lot of cases, are much more technically, knowledgeable and the experts in that domain. And we're leaning on them to help bridge that to other agencies that might have some kind of intersection, right? We're a lot of ways we're like a dot connector, right? And making sure that one thing's not happening in a silo over here, and then it's happening, a similar thing or related thing is happening in a silo over here, and they're not coordinating, or even worse, the direction they're going in is in conflict, right? And it's the wrong signal, because to an entrepreneur or to anybody that's being regulated by these agencies or impacted by their policies, they don't speak in the lanes of FDA or the lanes of ONC or the lanes of CMS. They just want to bring an innovation to market, right? And if FDA is telling them one thing and CMS is telling them another thing, and it's requiring something totally different or that's in conflict with each other, that can create a lot of problems. So it's an extremely challenging task. In other cases, we are the technical expert, right? That understands semantic data interoperability at a deep domain level, not just the actual ontology of the data, but also coming up with like the right way of the transferring of that data, right? The sharing of it, the interoperability mechanisms to exchange the data and mapping out those protocols and working with standard development organizations like HL7 and others, IEEE, you name it, in these different domains to help map out those protocols. And then also now, we're spending more and more time working on making all that data not only available for the right places, but getting the value out of it, right? Seeing all the value of this interoperable data that, 10 plus years ago, we didn't really have, right? And, 10 to 15 years ago, it was almost all paper back in like 2008, 2009, for the most part. Nowadays, it is digital and isn't, getting more and more interoperable. So we have a responsibility to look at how can we make it more valuable and do it in a responsible way. But so we are providing some of that level of guidance and expertise to the agencies, and especially through something this administration established called the Health IT Alignment Policy, which it's not like a nice to have to check in with ONC, but more of a requirement on certain procurement funding opportunities they put out or policies they release to make sure that if they're pointing to a data standard, it's also one that's being, if there's one that's being required somewhere else and it makes sense in that application, that they're pointing to the same thing and that they're not coming up with their own or some new one that doesn't jive with the rest of the system.
Stephen, it's interesting, right? Because I think we've met probably almost a decade ago. It's, Tamara, it's
Yeah.
Vastu, it's, and, we've been kind of talking about interoperability for, I don't know, as an ecosystem for probably 20, 30, too long, right? And it's not an easy answer, but to your point, you just mentioned HL7, there's fire, there's all these things. And you still hear and see patients, trying to get their own data, right? Trying to, as they move from, what do you think is the blocker? I guess and I know it's not a simple answer either, as it's not a simple task, but just curious kind of what you're seeing on the ground, right, with some of the innovators.
Yeah, so I mean, there's a lot of challenges. I think in the Cures Act and through the most recent HTI-1 rule, we did address a lot of those blockers, specifically information blocking, defining that in legislation in the Cures Act. It was the first time that was done, and actually putting forth provisions for the first time, giving us the ability as a federal government regulators to be able to levy penalties and fines against bad actors, right? The behavior of blocking information versus just the technical functionality, right? So pre-Cures Act, we had to make sure that electronic health records in the United States had the ability to share data. So we'd require things like open APIs or APIs for certain purposes. And they could say like, look, we have the API, we made it available, there it is, right? But then there was all these other behaviors and information blocking tactics that were happening, whether it be by the HR vendor or by the health systems or by, other parties. That was creating friction and actually seeing all that actually go into practice. But we had no mechanism to really enforce that or really, kind of hold people accountable, at least not clear, regulatory constructs. So with the Cures Act, it actually put us on a path to closing a lot of those gaps and actually going after who is doing the blocking of the information, who is actually doing that behavior. Now, since then, it takes a couple of years for us to actually roll that out, at scale. And we're at a good place now where actually, I think you find that today's environment for data sharing, getting data out of electronic health records in the United States is significantly easier and more streamlined than it was even 5 years ago. And you're hearing that from entrepreneurs who are, third-party vendors, others who are trying to work with these health systems and EHR vendors to get data and for the right purposes, or whether it's a consumer-facing application or whether it's a tool for provider to use, you name it. They are getting much more access than they did in the past, in the appropriate circumstances and so on. Plus, we've launched officially now TEFCA as a network-to-network exchange vehicle to make it easier to query across networks and get access to data for the right purposes. But there's still always going to be a chasing, you're chasing kind of the next area, the first thing that anytime we put out some new regulation, right? People, and if it closes down a certain, revenue stream of one actor and why they are blocking information, maybe they're going to be pivoting to find the next thing to exploit and look at, or figure out how they can kind of take advantage of it. And so that's where HTI-1 rule and in the future HTI-2 and others, those are a little bites at the apple of being able to close some of those other loopholes that we find and see as we're rolling out these things. But to date, I think, to your broader question about what are the biggest problems today, this is just my own personal opinion, but there's some things that that we've been faced with, some that are like unintended consequences of all the great work we've done to make data more interoperable and to make more data more available. For example, in the Cures Act, we also had to establish something called the U.S. Core Data for Interoperability, establishing that minimum floor of what data is going to be available in every certified electronic health record vendor in the US. And that's been huge so far. We're already on version 5, going on version 6. It continually evolves every year. It's on a rotating basis. It's kind of like I don't know if you're familiar with this, but if you're aware in how the Golden Gate Bridge is painted in San Francisco, they never stop, right? They paint in one direction, and when they get to the other end, they just come back the other direction. It's kind of continually painted year round.
Yeah.
Obviously, there may be a day or two of bad weather where they stop, but for the most part, they're always working on that, and they don't paint it and then wait for it all to fall apart, and paint all to peel off. They go back and paint it 5 years later, because it takes time to do that. And so we know that the field of data in ontology and all like that evolves constantly and is trying to keep with new technologies that need that data, or new emerging fields where they're more mature with using technology than they were years ago. For instance, in behavioral mental health space, or in maternal health spaces and other things like that, where the data maybe wasn't as mature and there's kind of evolving. In the field of cancer and oncology, there's a lot of challenges there where they're not using the same type of data formats and so on, and it's not readily available when they need it, especially for research and clinical trials and such. But we work with USCDI to try to make sure as much of that is available, and then and that just continually evolves and expands. And then on top of that, we have a program called USCDI Plus, which is voluntary. It's not mandatory or required, but it allows us to go into these nuanced areas, partnering with other agencies like the CDC for public health, or the FDA for quality, and so on, and in evolving more at a better maturity certain standards in those domains. So maybe some of that could end up in our required USCDI, or maybe it just helps be something that is voluntarily adopted. Actually, in the field of cancer, we started to evolve that, and as we were building it, because of the importance of it, we were able to bring a number of EHR vendors to the White House and other technology companies in the space, like Flatiron Health and Time Care, and talk about the importance of the USCDI Plus for cancer. And we got commitments from them to dedicate resources to adopting it and making it available to all their customers, because it was something that was, going to have broad industry input and support, and they understood the value of having that data available. And now they've committed to making it available, even though they're not required to. They're already building APIs related to that. So it shows like when you bring the industry together and you get them focused and you help validate, whether it's through SDOs like HL7, the standards development organizations, where there is an open consensus-based process, or if you're, as at the federal government side, if you're providing those venues through things like USCDI Plus, or even, requiring them through USCDI Core, it gets to a point where developers on the outside, whether they're an EHR developer or a third-party app developer or whatever it might be, knows like that's where the ball's going. That's where the rest of the industry is. I'm going to build to that standard of data, and then that makes it easier to plug and play once they're either digesting data or sharing data. It makes it so much easier for the data to flow.
Steve, let's jump into it, because you mentioned oncology, and I know CancerX is a big initiative. So maybe talk a little bit about that. Can you guys hear me? Okay. Yeah, it's coming through.
Yep.
Yeah, you froze for a second there, but I think we got it. So CancerX, extremely proud to speak of that. One of the things as a innovation portfolio lead for ONC I've gotten to do is work across federal government with other agencies and their innovation leads on a number of initiatives, but one of them specifically is on building a program with OASH. It started in the CTO's office when there used to be a CTO's office around, but ONC and OASH partnered on launching something called Innovation X. And it's a portfolio of public-private partnerships. It's kind of a model for how to launch them. You referenced one earlier, Pandemic X. We launched under that model. It was a one-time program during the pandemic. We had limited funding to spin that up quickly. But its predecessors that we did before Pandemic X are still going on today. And it was Kidney X and Lyme X. And we took those models and under the Cancer Moonshot tried to think of how can we launch a massive public-private partnership to accelerate the pace of innovation, specifically for digital tools in the field of oncology. They could be administrative digital tools, they could be clinical, decision tools, research-related digital tools. but getting more adoption, more development and adoption and commercialization of digital tools on a faster timeline. And that's the biggest thing here, right? If you look at these incubators and accelerators and all these things we talked about in the past, the benefit of them is that it helps more promising ideas cross the valley of death and get to the market faster with a greater chance of success, right? And through these public-private partnerships, that's what we try to do, is figure out how do we coalesce a community around these areas that are ripe for innovation. So in the case of CancerX, huge spend for the federal government. CMS is one of the largest payers in the world, spends billions of dollars on just dialysis treatment, right, for Medicaid and Medicare populations. There's two vendors in the entire U.S. marketplace, primarily a duopoly with Fresenius and DaVita. And if you ask them how do they do dialysis, right? It was at the time that we launched CancerX, the technology, the underlying technology for it was about 60 years old.
Right. 100%. Yeah.
And everybody, both, on the delivery side, as well as the patients, didn't like it. It's extremely, difficult thing to go deal with. You have to go to it, sometimes multiple times a week. You have to go to that site. It's not a very user-friendly solution, but that's what we were paying for. And there was no commission in it. And so we launched this national public-private partnerships, not just to improve dialysis therapies and treatments, related treatments, but also go further upstream to prevent more people from going on dialysis and so on with other types of solutions. And we partner with the American Society for Nephrology on that. Raised $25 million. Eventually, federal government started kicking in $5 million per year. And it supported building this ecosystem around kidney innovation and nephrology innovation. We did that then for Lyme disease. Each one is kind of adaptive to the unique needs and community that's launching it. So none of them are perfect, but it's a methodology of how we build that public-private partnership. Pandemic X was a quick one we spun up. And for that one, we learned for the first time that we really needed to get more agency engagement. So the other two, we had like one or two maybe agencies that were involved. With Pandemic X, we had like 8 agencies involved, all prioritizing what did they need to see as new solutions to help deal with the pandemic or future pandemics.
And what came out? I'm curious, what came out of that one? I mean, obviously, we know some of the big pharma kind of came to the rescue, right?
Yeah.
But just curious what you found in the Pandemic X.
Yeah, we had about 15 startups. I think it was 15 startups that actually made it through. So I think we had like 800 startups apply, or 1,200 that were sourced, 800 that applied from, I think a total of like, I want to say 30 countries, something like that. So it wasn't just US-based startups. And then we whittled it down through several, rounds of judging. We whittled it down to the top 15 most promising across 6 different sourcing areas that we were looking for new solutions in. And most of them check the box of more than one sourcing area. In fact, many of them check the box of 3 of the areas. So we're getting more bang for our buck, so to speak. But we saw a lot of very innovative solutions. One of them was actually an AI-related company out of MIT that was looking at, mitigating for bias and doing some systems level governance and making sure as they, either roll out solutions to deal with the pandemic. Because some of these things could also be applicable, not just in a pandemic situation, but in others.
Sure, ongoing.
Yeah, but they're looking at like how can you evaluate AI related tools and deploy them at an enterprise level, with more checks and balances and evaluation done both pre and post deployment. And so that was just like a really interesting one, and that's helped inform a lot of the work we've done. And there's been other companies like that have just helped on the responsible use of AI side of the house that's broader than just the pandemic. But a lot of them were also focused on working on community level interventions that were being built specifically with the cultural diversity and sensitive needs of certain populations in certain community settings. And it allowed us to think through that in the lens of the pandemic and some of the ways that we were doing outreach and engagement, and understanding that you needed to take a more tailored approach to certain geographies or populations, subpopulations, when reaching them to help prevent the spread, right? Because it's, the disease doesn't see geographic or, ethnic or, gender related barriers, and neither should we. So, so that was one thing. And we also learned some really interesting things just through the administration of the program. It was for the first time we embedded our health equity by design principles into launching the public-private partnership. And the theory of health, or the mantra of health equity by design is like, just like we have privacy or security in design, or putting the patient at the center of everything we do, that kind of thing. Health equity takes it a step further and says, not only do we design some for certain populations, but we also think about the programs and the policies we launch and, and what kind of equity impact can they have, both for a positive or negative benefit, right? Could it exacerbate inequities, or could it actually help improve equity? And so in building that public-private partnership, we thought, how can we weave some of those principles and thoughts into the design of it, not just into the companies we're sourcing, but into like how we even find them and so on. One of the things we did was working with Mass Challenge and their accelerator team, because we partnered with them on it, was deploying um, for the first time that I'd ever seen anti-bias training for our application reviewers and judges. So out of the 800 applications that got judged and scored, the reviewers who were judging them had to go through training to make sure they weren't letting their own biases get in the way of picking the best, most promising startup and company. So I thought that was really interesting how we did that. We also evaluated how many, the diversity of the cohort that got in. And we didn't make that a requirement, but we did look at the diversity after we selected them. And we think that the anti-bias training really had a lot of help, because we ended up with 66% of the startups that were in the cohort that got selected were BIPOC founders, minority owned and so on. And 66% of them were female founders. So we saw some great diversity just by embedding some, we think some really good bias principles into or bias, criteria and training into the program. The other thing that we did that was really interesting was on the application for the startups, right? And government has the ability sometimes to plant these little subtle nudges into society that helps them think differently or encourage a way of thought. And I think this was a very subtle example, but we built into the application process, when a startup filled out an application to get into the program, they had to answer some questions. And one of them was, how are they designing their tool or solution to take equity into consideration? And how are they building it in a way that it could be, appropriate in all settings or for certain subpopulations and so on, right? Like, how are they factoring that into design? How are they designing for equity with their tool? And some of them gave BS answers, and that's okay. You can kind of tell. But even for the ones who didn't have a good answer or made up an answer, it's planting that seed that they should be thinking about that. And let's go back to the drawing board, and where can we bake this in? Because if we get in, we're going to have to show it, right? Or whatever, or even if we don't get in, it's the right thing to do. And then we carried that forward into CancerX. So in Pandemic X, we learned those lessons. In CancerX, when we launched it, we embedded that into the design of it. And CancerX is like, a hybrid of like all the other previous ones where we learned lessons, and it's been by far the most ambitious and successful one that we've launched to date.
And where are you guys? I know we're almost at the end here, but where are you guys with CancerX? What's happening there? What's the latest? I mean,
yeah, we could probably have our own entire podcast
episode on that, I'm sure. Yeah.
It's been truly amazing. I'll give you some quick level stats. I'll give you the infographic. Okay.
Yeah, please.
So we launched it just over a year ago. It's about a year and a half now. It's been out. When we launched it, it was the federal government, the Digital Medicine Society, Jen Goldsack and her team, who I know you guys know well. And it was Moffitt Cancer Center based out of Tampa. So that was the three-legged stool that came out with the announcement from the White House saying, like, we are launching this new public-private partnership, right? Within 2 months, we had 90 organizations from every type of stakeholder you can imagine raise their hands, sign up to be a member, cut checks to be part of it, got involved in different work streams, and helped build this community. A few months later, we were at over 120. Today, we're at over 170. Amazing. If you look at the cancerx.health website, you'll see it touches everything from life science pharma companies, AstraZeneca, the list goes on. It has several cancer centers in the US that are part of it, cancer startups, big tech companies like Dell and Intel and Amazon Web Services. It's got patient-facing organizations. We were very considerate about making sure we had a lot of patient advocates and patient-facing organizations who represent their interests being at the table. It's got not-for-profits, membership organizations, state and federal government. And it's really been an amazing success story. We've got 3 verticals of work. The biggest one that's currently in play is focused. It was like our second major initiative. is focused on the startup accelerator. And that was the original vision, but it's like expanded beyond that. So the startup accelerator, we have sourced, we had over 100 oncology related startups who applied to get in at the end of last fall. At Vive this year, we announced and revealed the 16 companies who got in. They cut across a couple different sourcing areas. And we've been working with them. We're currently in the middle of that first inaugural cohort. Those companies have been getting access to investors. They've been getting access, and not just access to them. I think we've got several investors who have already made commitments to fund these companies, like during the course of the program. They're actually champions of the program. And then they helped in the picking out of the companies to get in it. We've got several cancer centers who have hosted them on site and introduced them to their whole C-suite and are partnering with them, establishing pilots. It's truly been an amazing program. And we have a whole curriculum program that includes federal agencies walking through, the types of programs and resources and funding opportunities we have, federal guidance and regulatory guidance and so on that's relevant to their companies. And so it's built this whole amazing kind of community around that. There's some pre-competitive work that we do on financial toxicity and health equity, kind of understanding why do families in the U.S. have over 2 times more likely to go bankrupt if they have a diagnosis of cancer in their household, and how unacceptable that is, and what kind of digital tools can help address that issue. And we've launched a bunch of we did a data sprint partnering with ONC and others and this whole community to validate as we build out USCDI Plus for cancer. Help being kind of another sounding board to make sure we're getting the right data available through USCDI Plus for cancer. And supporting not only those vendors who committed to it, but also, other ones who might want to join that commitment. So it's really kind of expanded. I know they have some new projects on the horizon on the demonstration project pilot side. One on looking at potentially, can we build oncology a hospital at home program? We have a couple members who want to do something around that. We haven't launched that yet, but we're exploring it. And we did just launch. We're in the process of, we've announced it. We're like getting the members to participate in it. A program around digitally enabled care. And that's also on the website if you're interested in it. But it's become this piece of an initiative that's really been amazing. And it gets back to those early principles about when you convene all these people and you get them in the right space and you start to give them some areas and a platform for collaborating. It's amazing what can be catalyzed out of that. And we've had some things that we just never even expected to come out of it, that did, because they were all together for the first time, all focused on digital tools. And they were all in a place where they can say like, hey, who wants to partner on this? Or like, yeah, I have a shared interest there.
And it's a huge problem to be solved, right? I mean, the prevalence, unfortunately, has been growing in our society, not just in US alone. So, kudos to you. And, I feel like literally every one of these topics can have its own hour and a half.
Yeah, for sure.
That deeper in. But given the fact that we're almost at the top of the hour, I'm going to pass it to Jim with his famous last question.
Oh, no.
Go from there. It's great.
Yeah. Well, Stephen, so let's go forward for a second to go backwards here. So you get an invite in the mail, or through your Siri or your Google, it's no longer in the mail. You get to come and do the keynote at the 50th anniversary of 1817, where they're graduating this amazing class of cancer startups that you helped selected, and some of them gone on to just revolutionize how cancer is paid for, and you're giving an inspiring speech about the 3 C's of collaboration and convening, and
we haven't evolved beyond that, but yeah.
And you're giving inspiring this, and then as you're sitting there and you're delivering the speech, you look and you see this incredibly polished, articulate-looking young man in the audience that's come running up to you and says, "I just came out of the Marines. I just did my first tour of duty with the governor of Chicago, and now I'm going to be joining a healthcare startup that's going to be dependent on working with the government. But I'm terrified about this. This is a lot going on. What's that one piece of advice you give to that young aspiring entrepreneur?"
Wow, that's a great question. I think there's a couple. That's a challenge that you had to try to like meld my whole background into this theoretical scenario. You did a pretty good job of it. So yeah, well, first of all, I'm really old if it's the 50th anniversary, right? So I don't even know. I might need some assistance in delivering that speech. But maybe the technology's evolved to where I could just think it and have it be delivered. Yeah, I think one of the things that, I think the way you talk to me about this in the past was like, what is the recommendation you give your younger self as you're embarking on all this, or some other innovator that's in a similar kind of early stage of their career. Um, and so, there's a couple of things I would suggest. One is continue to stay curious, like at every phase of my career. The things that I've been the most passionate about were things that I had no knowledge of a year before I started working on it, and it was something that through my curiosity I got exposed to, and wanted to learn more about it, and then it helped find my passion. So like finding your passion makes it so much easier to work on that. And if you're fortunate enough to get into a place where you can work on it, and that be your career, you find so much more, both self-fulfillment in it, but also desire to get up every day and get out there and not give up, and to try to tackle that challenge. Especially if you're an entrepreneur, you have to have that ethos of that mentality. And it's not unusual that so many entrepreneurs are one that comes from like a personal story, especially in the healthcare space, of like, my father went through this, my mother went through that, my wife died from this, whatever. And my experience in the broken US healthcare system was one where I needed to figure out there's got to be a better way of doing it, right? So the curiosity, I think, helps expose you to those types of opportunities where you can find a bigger passion. If you've already got your passion, then it's a matter of being open to new areas where you can apply that passion, or like new doors, right? Because they're going to come along, and it may seem like something that's, out of scope or out of left field. But, like when I first started in human rights commission, I thought I was going to become a lawyer and do like contractual law. And I thought it'd be a good place to be because I was going to work with lawyers every day.
Right.
But then I got exposed to this opportunity at Commerce, and I found my true passion around building innovation ecosystems, and thought I could have a huge impact in that. And I just wanted to learn more. And to this day, I still want to learn more about the science of innovation ecosystem building. And then how do I apply that in the roles that I've had? So I think those are some of the most obvious tips, and just not being afraid to put you in those uncomfortable settings where like you feel like you're not an expert. That's the other thing I say, is you get to mid-level of your career, you're going to start to be looked at as an expert, especially if you're someone who's passionate about it and you do the homework on it. And this is the other big thing, is not having imposter syndrome. So I know, like earlier in my career, when I was being put up for some of these big positions, I was like, can I handle that? Am I really the best person for that? Like what makes them think that I can be successful in that role? Because especially when I went to public health, I had zero healthcare background or knowledge. And the way that they sold me on it was, what, like they have all the subject matter experts in these different domains. They need somebody who can think about strategic public-private partnerships and modernizing the way they do their work, like all these other things that they're not well equipped to do. And you have that. And so you can go in there and help give them, again, the tools they need to be successful. And then as I did that, the curiosity side had me, peel back those layers of the onion. I had to understand all the programs, right? And figure out how can I help them. And that helped me learn about all those public health and healthcare related programs. So I think the other side there is that piece of like being willing to know, like, as long as you get that level of commitment and passion to become the most knowledgeable, or to listen to others, then go for it. Take those opportunities, because in reality, what I saw through my early career is when I passed on those opportunities, because I felt like I wasn't equipped, I saw other people who are even less equipped than me who had no problem taking that job,
Right.
get the job, and be less impactful or less successful with it, because they didn't have that drive and commitment and passion. So that's the other thing I would say is, like, if know your limits, but also like be willing to test them, and know that the passion and the drive is going to carry more weight than somebody who's got 30 years of experience, and more than likely in that 30 years experience has been worn down and is now pessimistic about being
I think it's going to be hard to wear Steve down, Eugene. Don't you think? This absolutely inspiring. Your energy is amazing. Stay curious. Stay open. That's amazing. That's amazing.
It's truth.
Thanks for joining us. Thanks for joining us. I know we've been looking forward to it. Appreciate it. And to all the millions of listeners, pass it on, subscribe, and share it out.
Sounds great.
That was great, Steve.
Thank you both. We'll see you soon.